All right. Hi, I'm Dr. Candace Mathers with Life Blossom Wellness. And today I wanted to talk to you a little bit about how naturopathic medicine can help individuals with Down syndrome go from struggling to thriving, especially since World Down Syndrome Day is right around the corner. So I am going to share my screen with you because I have a quick presentation and we will get started. So I want to talk to you about what I call the naturopathic approach to Down syndrome, especially Down syndrome health. The naturopathic approach is actually a whole body health system using natural medicine to help improve the lives of individuals with Down syndrome. So who am I? I'm Dr. Candace Mathers with Life Blossom Wellness. I am a licensed naturopathic doctor. I am also an acupuncturist. And most importantly, I am a mother to two amazing kids, my son and my daughter. And one of my children, my daughter, has Down syndrome. So I have seen firsthand how naturopathic medicine has given my daughter such a great quality of life. Now, when I work with individuals with Down syndrome, there's four big areas of focus that I tend to touch on that seem to be out of balance, specifically due to having a third copy of chromosome 21, which is what Down syndrome is. So these areas include motor strength, cognition, immune system function, and endocrine or hormone system function. Now, talking about motor strength comes into roughly two categories. Gross motor skills, which is the movement of the larger muscles like arms and legs, and then fine motor, which is the movement of the fingers, smaller digits. Now, individuals with Down syndrome tend to have delayed motor skills, both gross and fine motor skills. So that means that they might take a longer time to do things like running, jumping, or playing, especially with their typical peers. And having independence might come a little bit harder for them, or it might be slower. Well, what I do with naturopathic medicine is I help improve motor function and strength. Now, how do I do this? It depends on why a person's with Down syndrome, why their motor function isn't typically developing. Now, this could range from hormonal or endocrine disorders, which I will touch on later, to things like nutritional deficiencies or lifestyle concerns where they're just not motivated to actually go outside and start interacting with their typical peers. So it definitely depends on the individual. But one thing that I have found consistently is that individuals with Down syndrome tend to do well, especially with motor strength, when taking thiamine or benfotiamine specifically. So thiamine is a water-soluble form of vitamin B1. It's the form that's found in nature, found in many different foods. And it's extremely helpful for motor function, for muscle strength. And individuals with Down syndrome tend to have lower amounts of thiamine in diet, and especially just in their bodies in general. Their bodies don't necessarily use the thiamine that they're getting from their diet, especially if there's gut health issues. So I actually like to use a synthetic form of vitamin B1, benfotiamine, which is actually fat soluble. And that means that the body doesn't get rid of it as quickly. It stores it in the fat. And a person with Down syndrome is able to use benfotiamine to their advantage, improving their motor function. Now, cognition enhancement is one of the areas of focus that I especially enjoy because I think that cognition enhancement is beneficial for individuals with and without Down syndrome. And so when I talk about cognition enhancement, it's kind of an umbrella term for me that includes increasing memory retention, better language processing to better understand language, and then therefore better able to speak, decrease learning time so that they're able to learn a task quicker and retain that information longer. And basically, it's all about increasing neuroplasticity. So individuals with Down syndrome tend to have a few things working against them due to having that third copy of chromosome 21. Namely, they have few genes, the APP gene and the DYRK1A gene, that damages brain cells and makes learning and brain cell communication harder for them. Well, adding nootropics into their supplement regimen and into their diet can actually improve the cognition and the quality of life of individuals with Down syndrome. And so that's what I do with my clients, I actually look at what they're eating, and maybe they need to increase walnuts in their diet, which is actually a very powerful nootropic. Maybe they need to increase blueberries. Blueberries, powerful antioxidant and also a powerful nootropic food into their diet. And that actually helps to improve the brain function and brain health of individuals with Down syndrome. And then immune function. Immune function is huge for individuals with Down syndrome because recent research has actually categorized Down syndrome as mainly a pathophysiology, a dysfunction of the immune system primarily, which is very interesting because we look at it as a genetic condition, not necessarily an immune condition. And when you think immune system, you're always thinking about your body being able to fight off pathogens. People with Down syndrome tend to have a lowered immune function because there's higher amounts of oxidative stress, there's higher amounts of inflammation, and there's a lot of nutritional deficiencies, especially of certain nutrients and minerals like zinc, which actually helps to improve immune system function. And so helping an individual with Down syndrome with their immune function leads to less illnesses for them, quicker recovery times when they do get ill, and less severe illnesses. So less doctor's visits and less hospitalizations means more time spent enjoying the things that you and your child love together instead of trying to navigate through sicknesses. So I talked about zinc before. Zinc is very powerful when it comes to improving immune function in individuals with Down syndrome. Just by virtue of having a third copy of chromosome 21, individuals with Down syndrome tend to be zinc deficient, which shows up as skin disorders, as lowered immune function, as shorter stature, and as a lack of taste. So individuals with Down syndrome can benefit with adding more zinc into their diet, which is something that I look over when I work with my clients who have Down syndrome. And then there's endocrine function. And the endocrine system is actually the hormonal system of our body. So when you think about hormones, you're always thinking about male and female hormones, but those are not the only hormones in the body. In fact, the body has many, many different hormones. And if the hormonal system is not in balance, which can be typical of individuals with Down syndrome, then you have decreased sleep, more incidences of behaviors, and improper growth and development. So I work with individuals with Down syndrome to stabilize and bring into balance their hormones so that your child is getting better sleep, your child has improved moods, your child is doing well, they're growing, they're developing, and they're learning in the way that individuals with Down syndrome could and should. And one of the biggest endocrine system issues that a person with Down syndrome tends to have comes from the thyroid gland. Individuals with Down syndrome tend to have thyroid dysfunction at a higher rate than typical individuals. And we're not quite sure exactly why that's the case yet. It could be directly due to having a third copy of chromosome 21, but we're not quite sure. But there are ways with natural medicine using herbs or diet that you can help bring your child's thyroid function back into balance so that your child is growing, developing, and learning. Because the thyroid is actually extremely important in the early stages of life and throughout life to maintain metabolism, to improve brain function. And if your child with Down syndrome doesn't have the proper thyroid function, they're not going to thrive. So that's what I do as a naturopathic doctor. Now, that's not to say that I don't work in other areas of Down syndrome health. Gut function is huge, but with gut function, I usually work with all clients, all individuals with gut function. The integumentary or the skin system is huge in individuals with Down syndrome. But I don't just work with the skin system for individuals with Down syndrome. That usually comes with all different types of clients that I work with. Specifically, these four areas seem to come up over and over again in individuals with Down syndrome for me. There's also the circulatory system, heart health, respiratory health, and the hematopoietic or the blood system, because individuals with Down syndrome do tend to have more incidences of leukemia than typical individuals. So that's something that I always keep an eye on as well. But as I said before, the motor, cognition, immune system function, and endocrine function are usually the big ones that I tend to focus on. And I tend to see in an imbalance in individuals with Down syndrome over a long term and consistently. So how do I help people with Down syndrome bring all of these systems into balance? I keep on saying that I do that, but how does naturopathic medicine do that? Well, I use a really big toolbox. This toolbox here is huge. As a naturopathic doctor, I have many different ways to bring about the outcomes that I want to see in my clients. And one of the tools I use is herbal medicine. Herbal medicine is potent. It's gentle, but it's extremely effective. And herbal medicine has a lot of science and research behind it, contrary to popular belief. And using herbal medicine in individuals with Down syndrome actually helps to increase their outcomes and improve their quality of life. Then there's targeted diet and nutrition. Individuals with Down syndrome tend to do well when they take certain food groups out of their diet. The ones that come to mind immediately, gluten and dairy, especially for younger kids with Down syndrome. Dairy tends to be something that actually is very detrimental to people with Down syndrome's health because they tend to have an immunological reaction to the protein in dairy. So taking out gluten and dairy, especially for younger kids with Down syndrome, seems to work wonders on their health. And then vitamins, minerals, and body weight molecules. And I spoke before about zinc and benfotiamine or thiamine, but then there's also folate, there's vitamin D, vitamin A, magnesium is huge. And then body weight molecules like CoQ10 or glutathione that do wonders when individuals with Down syndrome take those. Now, when I say body weight molecules, I'm literally talking about molecules that our bodies make, typical and people with Down syndrome. Our bodies make these molecules and they're needed to perform different functions in the body, from working in the electron transport chain to improve respiration to reducing oxidative stress. And individuals with Down syndrome often have very lower form of these body weight molecules. So supplementing with these molecules actually helps to improve individuals with Down syndrome's metabolic profiles, and then they do well and have a better outcome, better quality of life. And then one of my favorites, nootropics or cognition enhancing substances. And so these actually help to improve brain function. They do that by either increasing blood flow to the brain, by decreasing brain cell death, by growing new brain cells, decreasing oxidative stress or inflammation. There's literally hundreds of ways that these nootropics, which do sometimes fall into the category of herbal medicine, sometimes not, actually help to improve brain function. And individuals with Down syndrome do very well actually using these nootropics when introduced in a way that's beneficial to them. And then acupuncture and acupressure. So both of these modalities are very much related. Acupuncture actually uses needles to stimulate points on your body's meridians, whereas acupressure uses just pressure that you can use with your fingers, ear seeds, or any other type of device that actually puts pressure on an acupuncture point. And doing this helps to release stress, pain, and improve the energy flow in the body, which is extremely beneficial to individuals with Down syndrome. Now, if your child with Down syndrome does not tolerate needles well, that's fine. They can always do the acupressure, and you can do the acupressure with them, or they can even do that on themselves once they learn the correct technique and the correct points to press. And then there's other modalities, and these other modalities range from biotherapeutic drainage and homeopathy to hydrotherapy, which is a application of contrasting temperatures of water to bring about therapeutic effect in the body. And so there's so many different tools, and within these categories themselves, there's so much within the category itself that actually the amount of resources I have available to help a child with Down syndrome it's almost limitless. So if you find something's not working for your child with Down syndrome, we can always stop and try something else. That's the beauty of natural medicine, because there's more than one way to get to a beneficial outcome for your child. So this is the story I always love to share. On the left is my daughter. I had just started a naturopathic protocol with her. Maybe we're about 2 or 3 days in. And on the right is 3 months later. So you can see on the left, she kind of had the low muscle tone. Her tongue was a little bit hanging out of her mouth, which is kind of typical of individuals with Down syndrome who are suffering from thyroid dysfunction and low muscle tone. And perhaps a diamond deficiency. And then here is about 3 months after I started her on a consistent naturopathic protocol tailored to her specific needs. And you can see she's completely different. And I'm very happy to say that. And this picture is when she was about 4 years old. She is celebrating standing on point for the very first time in ballet. And this is not, my daughter is not the only case. There's hundreds of individuals with Down syndrome who have found natural medicine to be beneficial for them. And now they're going on to thrive and do great things and experience an increased, improved quality of life. So if you are ready to change your child's life, this is something that you are more interested in, then go ahead, contact me today at lifeblossomwellness.com. It's contact@lifeblossomwellness.com. You can always go to my website, lifeblossomwellness.com, where I have so many resources. Follow me on TikTok at Dr. Candace ND, and then please like and share and subscribe to this video, and let other people know that their child with Down syndrome has so many options. And if you yourself are struggling, and you see your child struggling, you feel like there's nothing you can do, there's so many options out there for your child to live a full, happy, healthy life. So thank you for watching. I'm Dr. Candace Mathers with Life Blossom Wellness, and I will see you in the next video.